What role does MBI play in patients with dense breasts?
That's a great question. Molecular breast imaging is not going to replace a mammography. It's actually used as a supplemental imaging exam. So it's going to be used in combination. And we found that molecular breast imaging, when used with mammography, can find lots more cancers than just mammogram alone, especially in women with dense breast tissue.
Apart from having high sensitivity and specificity, is MBI used for any other purpose?
Actually, it is. We know it mostly to be used for somebody that has dense breast tissue, but MBI can also be used in replacement of an MRI. When a patient can't have an MRI, meaning they have an allergy to the contrast, they can't tolerate the positioning, or they're claustrophobic. When a patient is having an MRI, it may be because of having a high risk or they've been diagnosed with breast cancer and they're trying to find the extent of the disease, or if there's a breast cancer in the contralateral breast. So MBI can actually be used instead of MRI for these same patients. In addition, somebody who has had surgery to their breast, it can be helpful because that can be a challenge also for a mammogram. So somebody has breast implants or some other surgery to their breasts. So the last thing that we can use it for is that we can use it for a diagnostic tool. So if somebody has an inconclusive finding on mammography or ultrasound, MBI is another tool that we have in our toolbox to help the patient determine if she needs to have a biopsy or if she can go back to screening mammography.
Should patients be concerned about having exposure to a small dose of radiation with MBI?
Absolutely not. Molecular breast imaging, or low-dose molecular breast imaging, has a very small amount of radiation. It's just slightly more than it is for a mammogram. But both molecular breast imaging and mammogram are low enough to be safely used for screening mammography or for screening for cancers. The key is that both of them are at or lower than the natural background radiation we just get from being here on Earth. So the key is that the benefit of having a low dose of radiation to find the cancers at an earlier stage when it's more treatable and curable is much outweighs the risk of a low amount of radiation.
Could you explain to me what the breast cancer ribbons are on your lanyard?
Actually, on my lanyard, I have multiple colored ribbons, and each one of these ribbons on the cancer, the pins, actually symbolizes each one of my family members that has had a different type of cancer. So I have a lot of cancer in my family, and I've watched a lot of people go through lots of imaging, and to, again, have an MBI machine that can help detect breast cancer just more than just a mammogram alone is very important to me and my family.
I can tell that you're very passionate about this, and now we understand why.
Not only am I a patient, but I treat my patients, and I believe that my patients deserve to have every opportunity to find their cancer as early as possible, because that's where we have the greatest chance of treating and curing their cancer. Specifically with the MBI machine is one more step that we can cure breast cancer.